Welcome to Strengthening Teamwork in Nursing. My name is Yvette Maureen and I'm a nurse team coordinator. So on my first slide, team building in today's hospital, care delivery in a hospital setting involves multidisciplinary professional teams configured into a complex network of healthcare delivery. Nurses work alongside physicians and clinical specialists. Everyone works to provide quality, comprehensive patient care as part of this interpersonal team. The focus is not only to protect patients from risk, but we want people, individual players, as well as team leaders, to provide positive, engaging, resilient workplaces. Hospitals that have these kind of places report high levels of teamwork with recorded incidences of low rates of workplace injuries, fewer reports of workplace harassment, and lower employee turnover. So, why do nursing teams fail? Well, in healthcare, the lack of strengthening nursing teams really does affect the care. The high stress, the long hours, the burnout can affect nursing units. Poor team unity, people just not getting along, diverse work goals. Everyone has different goals in mind sometimes, and if everyone's not on the same page, nothing can get effectively done. And disruptive behavior, if there's clashing of personalities going on or gossip, people, they don't focus on patients. They focus on the conflict. And this can cause errors and delays in treatment for patients. And it could even be critical errors, like in medication. So neglecting the need to strengthen the quality of the teamwork will affect the standard of care provided to patients. So what's the solution? Well, teamwork makes the dream work. Studies have shown that optimal teamwork in nursing is directly related to staff who maintain high commitments in their position through a sense of ownership over job responsibilities. So to strengthen team dynamics, there's 4 areas that we should focus on for the main goal of improving quality of care and patient outcome while working to enhance and empower the responsibilities of each member of the nursing team. So the first would be addressing the conflict, because conflict in a small unit can negatively affect team dynamics. You can address effective communication, professional dialogue, which is important for strengthening interpersonal relationships with colleagues in a fast-paced environment. The next would be promoting informal leadership, which is creating an inclusive environment with a variety of team members, from the RNs to the CNAs, the LPNs, with the goal of cultivating relationships that share a common vision, and to ensure that each teammate has a leadership role which enhances their motivation and commitment through their active engagement that will help prove to others and themselves that they are capable and a part of the team. And the third is to implement evidence-based training, which is opportunities for the structured team to use utilized proven tools to serve as a basis of evaluation in their interventions, like goal checklist, making sure that the patient care gets done daily with an accountability sheet, and participating in unit huddles that will provide status updates that are up to date, and consistent care analysis, which will always enable fresh opportunity to ask questions. And finally, individual accountability, which clearly defining the roles in this kind of workplace will help resolve a lot of complaints and questions of the chain of command and making sure feedback is given to those who can incur change on floors. The purpose is to reduce errors by reinforcing policies and procedures, reducing the risk of legal repercussions caused by medical errors, and to ensure that priorities of the team are being collectively held up by each team member, so that each person has a responsibility to ensure that the team is efficient and associated with high levels of care, but also, maintain high job satisfaction of each teammate. So statistically speaking, there is a database called the National Database of Nursing Quality Indicators, or NDNQI, and they actually collect data from over 2,000 hospitals in the U.S., and they're used to make process improvements in hospitals. And they've noticed in their data collecting over the past couple years that there is a correlation with nursing happiness and higher levels of patient satisfaction. In these little infographics, you can see that the higher percentage of job enjoyment by a nurse, the quality has increased in the hospital about up to 20%. The benefits to the patients, 87%, the infection rate decreased by 87% in 2 years. Injuries were reduced by 17%, and hospital-acquired pressure ulcer rates dropped, from 24 to 59% in 2 years. And so that's all based on the happiness level of nurses. Implementation. Effective teamwork requires adaptability. The way you would need to resolve and implement these interventions, you would want to do the training in conflict resolution, helping colleagues work on improving their transparency in the workplace, clarifying expected job collaborations of nursing staff, making sure to define the expectations of each member so there's no confusion on the floor, making sure to ask questions, daily goal sheets to ensure that everyone knows the expected outcome of each day, and then an accountability and evaluation of the workflow to make sure that daily goals are being met. So, to conclude with this presentation, the overall theme is that strong teams get results. The healthcare team leaders that can produce engaging, resilient workplaces, especially for nurses, it increases the nurses' level of job contentment. Efficient teams provide optimal levels of patient care, positive patient outcomes, ensures there is going to be patient satisfaction reports. And these high levels of satisfaction reflects positively on a hospital's record overall, especially on the records of any clinical outcomes, patient retentions, medical malpractice suits. It all adds up. I'd like to thank you for watching my video, and if you have any questions, my information is right there. Please contact me, and thank you so much for coming.